9 Best Tips for Passing Anatomy and Physiology Exams. In this video, we have compiled the best tips for passing college-level anatomy and physiology exams. These strategies will enhance your studies not only in human anatomy and physiology. It will do so in a number of your other science and related classes. 1. Attend all lectures and lab sessions. The very first critical thing is to chase in-depth knowledge by attending all your lectures and lab sessions. Take comprehensive notes and utilize all other resources that your college professors or instructors provide. Review the material that will be covered before each lecture. If you do not have this privilege, use your course outline or a chapter of a book to prepare an overview of what to expect during the next lecture. Then after each lecture, be sure to revise your own notes as soon as you can. Sometimes you can review as you rewrite, since repetition is key in mastering most anatomical concepts. Do not stop at just highlighting relevant material in your textbook and notes. Write it down or retype it. Regurgitate it either as precisely as it is or by using your own words. Moreover, keep on meeting your instructors and lab teaching assistants. They will be more than happy to meet and help you prepare for your exams. Do not wait to see how well you will perform in your exams to consult them. Another key thing to do is to study the practice lab exams and any other quizzes at your disposal. 2. Know the anatomy medical terminology. Anatomy uses a unique code of language built from Greek and Latin roots. The reason is to allow anatomists to have a standard method of communicating and avoid confusion when naming structures. Knowing these anatomical directions and terms will help you describe the location and even the function of a structure. For instance, brachiocephalic artery. Brachio refers to the upper arm while cephal refers to the head. An artery carries blood away from the heart to a certain body part. Therefore, brachiocephalic artery carries blood from the heart to the head and upper arm regions. 3. Finding study partners is one of the best tips for passing college anatomy and physiology exams. Find a study partner or group that is seriously devoted to studying the subject. This is one of the best tips for passing college-level anatomy and physiology exams. The power your group members have to fill your knowledge gaps is simply priceless and cuts down your learning curve. Meet with your study group at least once or twice a week to go over lecture notes, textbook readings, lab review sessions, and practice questions. You will find that other members may have a different way of remembering or explaining some things, which may be quite helpful to you. Focus on finding members with the same learning style as you. Assign each group member a challenging topic and have that person teach other members of the group. After each topic, create a set of questions to discuss. Through the process of teaching each other and creating questions, you become better at comprehending concepts rather than cramming. 4. Anatomy and physiology flashcards. Since anatomy is a very visual subject, we highly recommend colorful flashcards with images. They may be time-consuming but quite instrumental. You can make them online or on index cards. Choose whatever works for you in terms of time consumption, ease to carry, and accessibility. Note that flashcards are only useful for smaller concepts that can be explained in short sentences and diagrams. Therefore, when making your cards, make them quick and straight to the point. You shouldn't write more than a couple of sentences, or else it will become a very time-consuming and less effective study method. After making the cards, keep them in sets of about 30 to 40 for each system. Create your flashcard content using your own words and make it as active as possible. Use abbreviations, pictures, colors, and arrows to connect concepts and arrange the information. Once the flashcards are ready, study them often. Use your downtime, such as during lunch breaks, as you wait for the professor to get to class, when commuting, or just before sleeping. 5. Mnemonics. Some content will require you to remember a list of terms, functions, and processes. Take for instance, the layers of the skin, cranial nerves, anatomical layers of the scalp, or even bones of the medial wall of the orbit. To make sure you remember key specific details, you can create fun, useful and easy to recall phrases, short poems, and acronyms. There are already pre-created mnemonics just waiting for you to memorize them, but some of them will not be useful if you do not understand them. There is no point in remembering all the small details, yet you cannot fit it together into one big picture. That is where creating your own mnemonic comes in. Take just the first letter or two for every word that you want to memorize, then form a list to create an acronym. For instance, if you want to make a mnemonic for the layers of the scalp, then you would use these words: skin, connective tissue, aponeurosis, galea, loose connective tissue, periosteum. All your mnemonics do not have to be so sophisticated. Remember that at times, the silliest or most inappropriate mnemonics will help you recall the toughest things. 6. Videos, 3D models, diagrams and other visual aids. Other than your course notes, textbooks and lab sessions, you can incorporate visual aids like videos, anatomy atlases, and anatomical models. Netter's Atlas is known as the Bible of Anatomy, and we highly recommend it. Using the anatomy coloring book is also another favorite choice that works well. Get a good book that is not labeled but has just sketches of the structures. You can then use it to test what you can recall. 7. Categorize systems according to their difficulty. It is important to remember that the human body organs do not exist as individual units. They are interconnected into systems that either directly or indirectly rely on each other to function properly. You may organize your studies to follow the body systems, including the integumentary, skeletal, nervous, digestive, cardiovascular, urinary, reproductive, endocrine, lymphatic systems, and others. You may also choose to arrange according to the regions like the head, neck, thorax, abdomen, upper limbs, lower limbs, perineum, and back. It makes sense to move from the simple to the most complex systems. 8. Preparation for when your exam approaches. A week before the exam, go through your most challenging parts, but of course, do not overlook other content. If you don't have much time left, do a selective study on specific areas. Never miss innervation, arterial blood supply, and venous drainage for any part of the body. For the body structures, know the anatomical regions, their boundaries, muscle insertions, their actions and functions. In embryology, strive to understand the derivatives of each ridge, while histology requires you to master the appearance of the slides of most critical tissues. 9. Study past anatomy and physiology exams. After taking your exam, take advantage of the test itself and use it to prepare you for the next exam, regardless of your score. Go back over the entire test, paying extra attention to what challenged you the most. Use the questions for future practice sessions and keep an eye on the upcoming material that may challenge you the same way. So let's summarize. Whether you are studying to become a nurse, doctor, physician assistant, or any other healthcare provider, anatomy and physiology is a subject that you have to take in order to become a healthcare professional. A good study plan will help you, but it is comprehension and mastering of the content that will get you that passing grade. By making sure that you attend all lecture and lab sessions, take good notes, and work with anatomical study aids outside your classroom, you can chart your way to an A. We hope that our tips for passing college-level anatomy and physiology exams will give you the framework to your success in human anatomy.